No two people are affected in quite the same way by rheumatoid arthritis, and so you will need to sit down with your doctor and draw up a rheumatoid arthritis treatment plan which addresses your particular problems and suits your own lifestyle. A typical rheumatoid arthritis treatment plan might include rest. Rest is essential for joints during any flare-up, as trying to use a joint under these circumstances will almost certainly make matters worse rather than better. Rest periods can be built into your daily routine to accommodate flare-ups, and if necessary, complete bed rest during such episodes may also be in order. One plan which many people find effective is to temporarily immobilize an affected joint with a splint during flare-ups. One important point to note, however, is that joints should be moved very gently from time to time, even during flare-ups, and not held rigid for extended periods of time. If this is not done, the joint could lock up completely. Diet. We are what we eat, and diet forms an important part of any rheumatoid arthritis treatment plan. As with health in general, you need a balanced diet with plenty of fresh fruit and vegetables and a minimum of processed foods. To counter the inflammation, you should also ensure that your diet contains plenty of fish, fish oils, flaxseed oil, black walnuts, green soya beans, and other similar foods. You should also stay away from things like sunflower, safflower, and corn oils. Many people also find that vitamins and supplements help, and you might consider taking antioxidants such as vitamin C and vitamin E, as well as selenium. Exercise. Exercise is a particularly important element of any treatment plan, as despite the fact that it may seem odd to talk about resting and exercising joints as part of the same plan, exercise is vital to preserve the maximum movement in affected joints. Exercise helps to strengthen the supporting structures within your joints and also to improve flexibility. Careful exercising of inflamed joints is also important to stop them from locking up. Exercise needs to be planned out and done with care, as exercising incorrectly or overdoing things could easily have the opposite effect to that intended. For this reason, you should discuss exercise with your doctor, and you may find it beneficial to work with a physiotherapist. Joint protection. Posture is important in general, but it is especially important when arthritis strikes, as poor posture can put added stress on your joints and do further damage. It's important, therefore, to maintain good posture when sitting, standing, walking, lifting, and indeed when making any sort of movement. Hot and cold compresses. Both heat and cold can help to ease inflamed and painful joints. In general, most people find that applying a hot compress can help to ease sore muscles and increase circulation within the joint, while a cold compress will help to reduce pain and lower inflammation. Medication. There are a wide range of different medications which can be purchased over the counter or prescribed by your doctor to help with the management of rheumatoid arthritis. For mild cases, simple analgesics such as paracetamol or non-steroidal anti-inflammatory drugs such as aspirin and ibuprofen may be sufficient. There is a wide range of both analgesics and non-steroidal anti-inflammatory drugs available, and these alone can cope with quite severe pain when used in the right combination. The problem is that each of us reacts differently to specific drug combinations, and what will work well for one person may not work as well for another. Here, therefore, it is a case of working with your doctor and experimenting to find a solution which is effective for you. If analgesics and non-steroidal anti-inflammatory drugs do not do the trick, then your doctor may suggest trying disease-modifying anti-rheumatic drugs or corticosteroids, which are powerful anti-inflammatory drugs. If these too fail to meet your needs, then your doctor may move on to use the latest weapon in the armory against rheumatoid arthritis, which is known as biological response modifiers. These drugs, which are also known as cytokine inhibitors, are designed to alter the course of rheumatoid arthritis by inhibiting certain actions within the body's immune system. Surgery. If all else fails, then your doctor may suggest that you consider surgery. There are various different approaches to surgery, including such things as removing the lining from diseased joints, replacing a joint to both ease pain and correct deformity, fusing vertebrae in the neck to prevent spinal cord compression, removing or fusing joints in the foot to both relieve pain and aid walking, and the fusing of a thumb joint so that the thumb can be used to grasp objects. If you would like to learn more about rheumatoid arthritis, then please visit arthritisquestions.org today.